Right, time's up. Mr. Davies.
Being with us and to your staff. Minister, in 2009, the H1N1 flu virus caused 428 deaths in Canada. In response, the federal government mobilized an emergency operations centre 24 hours a day, 7 days a week. This provided more than 6,000 person days of assistance to help coordinate emergency responses across the country. Now, in comparison, we have had 2,800 deaths in 2016 and 3,000 deaths this year from the opioid overdose crisis. And yet only 113 person days of assistance have been reported by the Public Health Agency of Canada, and that's to help write 2 reports. In addition, during the H1N1 outbreak, the Public Health Agency of Canada spent $322 million on communications and advertising alone. In contrast, your government's total commitment to fight the opioid crisis is $123.5 million, and that's spread over 5 years. So, Minister, my question is this, given the longer, more entrenched and more serious death toll of the opioid overdose crisis, why has your government's response been so substantially less than what was done for the H1N1 health crisis?
Well, thank you very much, Mr. Davies, for the question. We've had an opportunity to discuss this, I guess, one-on-one, and I'm happy that you bring up the question again today. We also have to recognize that the issue of the opioid crisis, as I've indicated in my earlier remarks, are quite devastating when we look at the numbers that are coming in right now. And again, with the report that came out from Ontario, it's very alarming to see the numbers that are coming up. But I have to say that our government certainly has taken bold steps so far in order to address the situation. When we formed government, one of the first bills that was brought forward was Bill C-37, and a bill that really streamlined the application process to make sure that individuals had access to supervised consumption sites. And we recognize that that saves lives. Also, with the issue of naloxone, we know that making sure that naloxone was a non-prescription type of medication that was available for people, that also saves lives. When we look at the information or the funding, that was given to provinces and territories when they told us that they were dealing with a targeted situation in their provinces, again, a specific funding was given to them. If we look at British Columbia, your province, they received additional $10 million with respect to targeted funding, and also with respect to Alberta, they received some additional funding. Okay. Just last month when I was in Calgary as well, we've made some announcements. When we look at the Canadian substance use strategy that was put in place, we've also made some investments there as well to look at the issue. And again, when it comes to services that are on the ground, it's truly important to make sure that we continue to work with provinces and territories. The federal government absolutely has a role to play, and we certainly cannot be complacent when it comes to this crisis.
No, absolutely not.
It is absolutely, for me, as I say, as health minister, my #1 priority. Okay. And when I say this situation keeps me up at night,
it does.
It really does.
Well, Minister, the question was on how I was asking you to contrast why the federal government spent triple the amount of money on H1N1 than today, and I didn't hear an answer to that. But I'm going to move to medicinal cannabis. My colleague brought this up. From a health perspective, we know that medicinal cannabis is not zero rated, so already medicinal cannabis users have to pay GST and HST. We know that most prescription plans in this country don't cover medicinal cannabis, so already men and women who are struggling already have to pay extra money for medicinal cannabis. Ironically, opioids are covered by most plans and are zero tax rated exempt. So ironically, patients are incentivized to pursue a riskier option, and that's even compounded by the fact that studies are now showing that medicinal cannabis is proving very effective at helping people wean themselves off of opioids. So it's clearly a flawed policy to make medicinal cannabis more expensive than opioids. So I'm just wondering if at the cabinet table, Minister, would you advocate from a health perspective to at least treat medicinal cannabis the same as opioids?
Well, again, as indicated, the previous speaker, and I forget your name, and I don't have my glasses, so my apologies, as indicated, with respect to tax policy, again, the Minister of Finance, that's absolutely his area and the work that he's doing. And again, as indicated, next week, the Finance Minister will be meeting with his territorial and provincial counterparts, and I am certain that that issue is going to be coming up. And again, if the Finance Minister, I don't know if he ever appears before the Health Committee, but if he does, it would certainly be, a question to be asked there.
Okay, I want, now we know that the federal government covers the cost of medicinal cannabis for over 3,000 Canadian veterans. We heard testimony at this committee on September 14th from the Regional Director of First Nations, Chief Isidore Day here, that the government does not cover the cost of medicinal cannabis for Indigenous patients at all. Can you explain that discriminatory policy to me?
To be very frank, that is Minister Philpott's department has been working with that, but perhaps that I could ask my Deputy Minister to perhaps address that a bit.
You know, Minister, if I may, I just want to direct my questions to you because I think we'll have the staff staying after and we can follow up them, but we only have you, I think, for an hour, so I'll just defer that if that's okay.
Absolutely.
I want to move to prescription drugs. I want to read you a passage. Prescription drugs. Our current system provides full coverage for institutional care, including all drugs administered during a hospital stay. Once patients go home, however, they are not guaranteed public coverage for medically necessary drugs. Although some public coverage is provided for specific groups and situations, prescription drugs have yet to be fully incorporated into provincial health insurance schemes. Many Canadians have limited drug coverage through their employers, but a full 12% of Canadians have no coverage at all for prescription drugs. This situation is plainly inconsistent with the values upon which Canadian Medicare is based. It is both unfair and illogical to guarantee access to medical diagnosis but not to the associated treatment. Neither does it make economic sense. Those who cannot afford to fill their prescriptions tend only to get sicker and require more costly treatment later from the public system. Public coverage of medically necessary prescription drugs, as recommended by the National Forum on Health, would not only ensure universal access to treatment, it would also reduce the amount of money that Canadians are already spending on drugs.
We need a question.
I'll get to that, Mr. Chair. These advantages include simplified administration, volume discounts for bulk purchasing, and improved monitoring of best practices for prescribing. A new Liberal government will pursue a strategy together with representatives of provincial and territorial governments, health service providers, private payers, employers and unions, and consumers to address the fact that drugs have become an essential component of health care. We will develop with these groups a timetable and fiscal framework for the implementation of universal public coverage for medically necessary prescription drugs. Minister, I'm reading to you from the Liberal platform in 1997. Promised by Jean Chrétien. Now, we've heard the PBO report has already shown we can cover every Canadian and save $4 billion a year. I introduced a motion in the House of Commons asking your government to start discussions with the provinces in the next 12 months, and you called that proposal premature. Can you explain to me why, after 20 years of promising federal national pharmacare, can you tell us what you're waiting for, Minister?
Well,
just very briefly, because we're way over the time for the questions, so if you could just give us a quick answer.
Thank you. I'll try to do it as quick as I can. How's that? If you've read my mandate letter, and I'm assuming on the Health Committee that probably most members have read my mandate letter, I'm going to quote, "Work with provinces and territories to improve access to necessary prescription medication. This will include joining with provincial and territorial governments to negotiate common drug prices, reducing the cost Canadian governments pay for these drugs, making them more affordable for Canadians, and exploring the need for a national formulary." Again, as indicated when I had the opportunity and the privilege to meet with the Ministers of Health for the first Ministers' meeting, we were able to come up with a consensus that we all want to work on improving access to affordable medication for all Canadians. And again, when we look at enhancing our healthcare system, we certainly want to make sure that enhancing the affordability, the accessibility, and the appropriate use of prescription is absolutely mentioned in that. So thank you.
That's all we can handle. Okay, now we're going to go to Ms. Sidhu, and I understand you're going